A Brazilian butt lift is a procedure used to reshape the buttock. This involves both improving the overall shape and contour as well as the size of the buttock. Now, this is an addition-subtraction procedure, meaning we first subtract fat from around the butt, suck out fat from the flanks, the back, the thighs if needed, the abdomen if we need extra fat. Basically, we suck out all the fat that we need from around the butt, which doing that in and of itself makes the butt look better. Then we take that fat, process it, and re-inject it into the buttock where the buttock is deficient. And so, depending on your pre-operative buttock shape, you may need more fat added to certain areas of your butt than other areas. And I use the fat that I remove via liposuction to help reshape the buttock and increase the size to meet your goals. If all you want is certain deficient areas of your buttock filled in, we can do that. If you want to have the deficient areas of your buttock filled in and have an overall larger buttock, we can do that as well. So in essence, a Brazilian butt lift involves removing fat from unwanted areas around the buttock and other places on your body if we need more fat, and then grafting or injecting that fat into your buttock where you need it. Now, the biggest risk with a Brazilian butt lift is a fat embolism. So we are all very careful not to cause a fat embolism. And I do that by only injecting in your subcutaneous fat, by using a large blunt cannula, and by injecting with very low pressure. So we keep fat out of your veins, or we do our best to keep fat out of your veins by keeping the cannula out of the muscle. And by using a dull cannula, it is unlikely to pierce the muscle. And by using low pressure, it is unlikely to force fat into your veins. And by injecting in the subcutaneous fat layer only, we really minimize that risk of fat embolism. So in summary, a Brazilian butt lift involves removing fat from the unwanted areas of your body and unwanted areas around your buttock, and then injecting or grafting or transplanting that fat to areas of your buttock where you need it. And to do this safely, we have to keep the fat that's grafted or injected into your butt out of large veins. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.